Opening credits. Cognitive Behavioral Therapy, Overcoming Anxiety, Phobias, Depression, and Eliminating Negative Thoughts. Written by John Ross. Narrated by Ray Stevens. Cognitive Behavioral Therapy, Overcoming Anxiety, Phobias, Depression, and Eliminating Negative Thoughts. Contents. Introduction. 1. Introduction to Cognitive Behavior Therapy. 2. Know your enemy. 3. Starter exercises. 4. Mindfulness meditation. 5. Excising bad habits. 6. Exercising for combating negative thoughts. 7. Exercises for combating depression. 8. Exercises for combating phobias. 9. Exercising to combat anxiety. 10. Sticking with it. Conclusion. Description. Introduction. Congratulations on downloading Cognitive Behavioral Therapy. Rewire your brain by overcoming anxiety, depression, phobias, and eliminating negative thoughts. And thank you for doing so. The bad news is that approximately 40 million people between the ages of 18 and 54 are currently dealing with some form of mental issue that is more intense than that which is experienced by their peers. The good news is that this issue is manageable without the use of pharmaceuticals, and one of the most effective ways of taking control of your mental state is through the use of cognitive behavioral therapy. Cognitive behavioral therapy is a version of psychotherapy which aims to alter negative thought patterns for the better, and the following chapters will discuss a wide variety of ways to do just that. First, you will learn all about cognitive behavioral therapy and the many ways it can benefit those who are in your situation. With the basics out of the way, you will learn more about the issues that cognitive behavioral therapy deals with most effectively, so that you can be prepared to get started putting them behind you once and for all. From there, you will find a wide variety of starter exercises to help you start dealing with your issues in the moment, as well as a detailed look at mindfulness meditation, what it's good for and why you should already be practicing it. Next, you will find a discussion of the bad habits in your life and why getting rid of them will likely do your mental state a world of good, along with specific chapters focusing on exercising, devoted to cleansing the mind of negative thoughts, depression, phobias, and anxiety. Finally, you will find tips for sticking with it in the long term and ensuring you remain successful throughout. With so many choices out there when it comes to consuming this type of content, it is appreciated that you've chosen this one. Plenty of care and effort went into ensuring it contains as many interesting and useful tidbits as possible. Please enjoy. 1. Introduction to Cognitive Behavioral Therapy. Cognitive Behavioral Therapy, CBT, is a form of psychotherapy that seeks to analyze why you feel certain ways and how you see certain situations. Because anxiety is a reaction to these things, and because it results in distorted thinking and perceptions of reality, CBT shows patients a healthy, more realistic way to think. At its core are a few simple beliefs. The first is that thoughts influence actions and behaviors. This is usually represented on a diagram in a cycle. It illustrates that if we can change one component of the cycle, then we can change all three. It also shows how these things are all interconnected rather than independent of each other. The second concept is especially important as it relates to anxiety. Even though CBT can treat many forms of mental illness, anxiety's nonstop obsession with what can be makes us feel like we've lost control over our lives and everything around us. But that isn't the problem. The problem is that it tries to make us take control of everything to protect ourselves. CBT teaches us to accept what's beyond our control and to recognize and hold on to what is. This is largely done through introspection. CBT works on the assumption that thoughts, behaviors, and feelings are all constantly interacting and influencing each other. Thus, the way a person thinks or interprets a given situation will ultimately determine how they feel about it, and thus, how they will react to it. For example, consider a pair of individuals who both recently failed to do as well as they would like on a difficult and important test. The first person thinks that if they were smarter, they would have done better on the test, which must mean that they are stupid. They feel anxious about the idea of future tests, and depressed
Sample complete. Ready to continue?